Let's go to Canberra now and catch up with infectious diseases physician Professor Peter Collignon. Good to talk to you, Peter. That's good news out of Sydney today. There's still a chance, of course, that there could be more cases turn up in the next few days. The mask wearing, though, that's come in on top of this, is that going to be particularly effective, or is that more of a reminder to everyone that we've got an outbreak to deal with?
Well, I think it probably is more a reminder. I mean, wearing a mask, if you've got an infection, decreases your chance of spreading it to others. And there is presumably at least one other person out there who has got the infection, and maybe more, that we haven't found yet. So, look, I think in crowded indoor spots in particular, because that's where you're likely to spread it, wearing a mask for a short period of time, it increases or decreases the risk you'll spread it to others and having other people, get infected. But at least it's actual sensible mask advice. I mean, the places that make you wear masks outside, I think, what's the point? I mean, it's really unusual to spread this outside, and there's no restrictions on being outside, all of things that actually decrease your risk. So, you can argue, did they need to do this yet? But so far, the response has been proportionate. We're not overreactive. And we do actually need to try and see if we can work out where this is coming from, because these cases where they occur in the community and you don't know where they're coming from, they're the ones that are the most dangerous. They're really small in numbers. But it actually means, hey, for some reason this is in the community, and it means there's at least one other person there we haven't found yet. And so we do need to make a more effort. We need to get more people tested. We should decrease the chance of spreading this to others. And given that we're going to have this problem for at least another 6 months, I think occasional reminders for a while is not a bad idea. But that's quite different to doing a short lockdown, which I think has got a huge amount of social and economic costs. And as far as I can see, all the short lockdowns have been done in New Zealand. Across Australia, there's been about 8 now. None of them have made any difference for finding any more cases, or no evidence I can see it's decreased any spread of infection either.
Yeah, you've pointed out before that the data shows that they haven't really added to the effort at all, and it's fascinating in Sydney now watching the public information going out, trying to trace down those places, trying to find that missing link, as you say. So thank God that one government's doing it this way rather than with these ridiculous short-term lockdowns. I want to ask you, Peter, about the India virus. Now, we know that India is going through a terrible tragedy and trauma here. And it has a long way to run. But what's your advice so far on talks of an Indian variant of the virus being, more contagious, more deadly in India? Is that likely, or are we seeing it going through on delay what the US, the UK and Europe went through last winter?
Well, so far that would be my view. We're seeing it on delay. But also, India is a poor country generally. So crowded housing, all the things that make this more likely to spread goes with socioeconomic disadvantage. And India has a lot more of that, as well as having a health system that's not as well resourced as good as ours as well. So they've got a double problem. They're likely to have more spread because of socioeconomic reasons, and they're likely not to be able to cope with it on a per capita basis as well as we could, or even the US and the UK. But this issue about variants occur. They are can be more infectious. The UK variant is, more infectious mainly because you stay infectious for a day or so longer. And maybe they can cause more harm. But so far, I would think the main issue with India is it just doing what has happened previously in Europe and America, and, with a system that won't be able to cope as well. So I personally don't think it was a good idea that we should have stopped all people coming back from India who were citizens. I think we should have let them come. The whole point of our quarantine system is it's supposed to be able to work to quarantine people with infections. And overall, their rate of infection isn't that much higher than we cope very well with US and UK strains. So I couldn't actually see, providing we keep some, limit on numbers, because overall there's only about 8,000 people we can have, I think, in quarantine at any one time. But, we should have been able to handle them as well as anybody else coming back from overseas. I'm
so pleased to hear you say that, because this has been my view, and I've checked all the data and keep checking it, and it bears out exactly what you're saying. I'm so pleased to hear it from someone so schooled in the science as you are. And just on that, finally, look, Hotel quarantine, we all would love it to be absolutely perfect, and we should always look at refining it, improving it if we can. But I'm thinking it's getting a bad rap at the moment. It's been more than 99% effective in this country, and surely it's not our weakness. Surely it's been our success.
Well, I think it has been a success. It is maligned, but it decreased our risk by about 100-fold. As you say, it's been 99% successful. And we have no transmission here of any note that's caused outbreaks. So it's very successful. Now, is places like Howard Springs better than, hotels in Victoria? Well, probably, but a lot of that has been to do with infection control procedures that haven't been followed properly. Lack of training, people not wearing masks in places where they should be wearing masks, ventilation that has actually sent the virus from one door to another down the corridor. All those things we need to learn from and do better. But relatively speaking, you look at New South Wales as they've done more than this than anybody else, and they particularly have a view that they put their high-risk people in Medi hotels, which are really apartment hotels. As far as I can see, even though that's where they've had well over 1,000 people with infection, they've been there for 2 weeks or more, they haven't had any cross-infection in those high-risk areas where they've had very good infection control, very good training, very good supervision, and appropriate ventilation, etc. So it is a success story, and there will be invariably leaks if we want no risk at all, which I think is permeating people more and more. Not only with hotel quarantine, but even the vaccine. We want a vaccine that's 100% perfect and zero risk. Well, these expectations of zero risk, I don't think are obtainable. We need to aim for zero, but that's different to saying, hey, we're always going to achieve this. And our quarantine system, including our hotel quarantine system, has been a great success. And where there's been failures, you can usually identify those causes. And there have been basic infection control procedures rather than anything fancy most of the time.
Peter, thanks for joining us again.
Thank you.
Professor Peter Collignon there again, live from Canberra. Always a voice of reason here. People have got to focus on this, just how successful we've been. We're now talking about trying to stop any people who are potentially infected going into hotel quarantine. That's the reason it's there, to identify and isolate and help those people. That's the whole purpose of hotel quarantine.